Once again, a very warm welcome to all of our attendees this morning. We just want to remind you about the tips to continually prevent COVID-19. Obviously, during this month of September, we are going to be looking extensively at COVID-19, the vaccine around COVID-19. And you might be wondering, why are we handling this in a Toolbox talk? Well, Toolbox talks are designed to bring awareness on occupational health and safety matters, especially matters that safeguard the lives of our employees. Now, it is definitely no new news to you that COVID-19 is out there and that we need to look at these tips to continually prevent COVID-19. So as we look at that during the course of this month, the questions that have arose through the discussions with our plumbers in the industry, in fact, through discussions even with occupational health and safety professionals out there, are things like, is the COVID-19 vaccine mandatory? And the directives or consolidated directives on precautions to have in a workplace direct employers to make a policy whether they are going to have the vaccine become mandatory in their company. Now, this sparked quite a few questions, people saying, well, what is my constitutional right? How does this affect my religious beliefs, my personal beliefs, my opinions? And these are all of the questions that we want to answer. In fact, during the entire course of September, we are going to be looking at all of these questions focused in a Toolbox talk presentation, because remember, it is occupational health and safety. So yes, we will always have a safety thought during September, because we always want to encourage you to think safely, have that risk-based thinking as long as you work, and we'll always end with something encouraging based on safety side, but we also want to focus on health. And we know that you are also cared about your health and the health and safety of your employees. So today's discussion is really taking a look at what does the law say about mandatory vaccinations. But let's get right into it. The consolidated directives tells us that we must decide as employers whether we are going to make vaccination mandatory. Now, whether we are going to, not that we are going to. In other words, it is a decision. But what is the COVID-19 vaccine? Well, in terms of a definition, the consolidated directives gives us the meaning. It means a vaccine that has been scientifically evaluated and recommended by the World Health Organization. All right, so remember, this is not just a South African thing. The vaccine is not actually coming from South Africa. It is being imported. And the World Health Organization is the one who is recommending. So there are actually lots of vaccines out there. So just to let you know, there are currently, quite a few, probably 100 of vaccination treatments that has been sent to the World Health Organization, but only 2 have been recommended from the World Health Organization as a viable vaccine for SARS-CoV-2. And then it's also been approved by the South African Health Products Regulatory Authority to be effective. And now notice the description here, because we want to be very clear on what is a vaccination. It is effective in preventing severe disease and death. So you might still get sick, but you won't get severely sick or die. Now, is that 100%? Well, no, it's not 100%, because with everything, it is still trial and error when it comes to vaccinations. But also it mentions that it is likely to reduce SARS-CoV-2 viral transmission in order to contribute to herd immunity. So this is really the whole crux. This is what the Department of Health and Labor is actually trying to do. In fact, this is what World Health Organization is trying to do, to create herd immunity. Now, if you don't know what that is, we've put the definition there for you. It occurs when a large portion of a community, the herd, becomes immune to a disease. Obviously, because they've taken the vaccination, they might still get sick, but they develop antibodies. And what this does is it creates a stronger immunity in a person's body. The vaccination obviously helps with this by giving you some part of that virus in order to boost your immune system. And what this does is you still might feel ill, but you do not get severely sick, and you do not get to the point where you're likely to die or to have severe after effects or side effects. Now, every person is different. There's over 8 million opinions, if we can put it that way, 8 million bodies. No two people are the same. Even twins will have different reactions to the vaccination. And so herd immunity is trying to make the spread of a disease from person to person unlikely. In other words, if you haven't been vaccinated, but the majority have, they become immune, which means they stop passing it on. And this will then reduce the number of infections, whether you have been vaccinated or not. And hopefully, as a result, the whole community becomes protected, not just those who are immune. So the immune then help to boost those who are not immune by limiting the spread of the virus. So we hope you understand it, and this is really what the Consolidated Direction on Occupational Health and Safety Measures in certain workplaces is trying to achieve. Now, this is the latest one coming on the 28th of the 5th, 2021. We've just broken it up into a few sections to discuss exactly what the law is telling you as employers and employees to do. So we are only going to touch on the sections within this legislation that impacts the vaccination. So we're not going to go through the entire one. Obviously, it is available for you. If you don't have a copy and you don't have access to our Dropbox link, send me an SMS, send me a WhatsApp, send me an email. I will send you these directives. Otherwise, you can look them up. Google that entire section. If you can see I'm scrolling on the screen. I don't know if you can actually see it. I'll point it out for you as well. I'll put the laser pointer there. The Consolidated Direction on Occupational Health and Safety Measures in certain workplaces. Please remember to look for the one that has got the latest release date. So if you do have that, obviously you want to ensure that all of that is available for you. But it is not necessary to download it, but it would be a good idea to have at least one copy available for your company. Now, under Section 3 of this directive, it states that risk assessments and plans for protective measures must be implemented in a company. In fact, within 21 days of the coming into force of this amendment, of this direction, in accordance with your Occupational Health and Safety Act, which you already know as employers and employees, Section 8, the duties of employers to their employees, and Section 9, duties of employers to those other than those in the employment. And this is all from the OSH Act. So this is strengthening the OSH Act. You need to take into account the operational requirements of the workplace. In other words, how does your company work? How much exposure do you have? And where is your risk rating? Is it low, medium, high, catastrophic? Do you have continual people coming in? If you think of a restaurant, you have different people coming in all the time, different workers, different shifts, and you don't know how to limit the amount of people unless you limit the amount of people in an environment at any given time. But after a couple of hours or even minutes, sometimes that person is out and a new person is in. And so that is a very high risk area if you are working in that type of retail industry. But if you are working in an office that doesn't necessarily have any access for members of the public to come into your offices, then your risk starts going lower. So whoever your risk assessor is, your safety officer, your safety manager, your safety consultant for your company, whoever it is, ensure that they've designed a proper risk assessment, outlining what is the operational requirements. And these are critical activities within your company in order to perform services that are vital to your business. So these are things that make your business run. And these critical activities will tell you whether you are in a high risk, low risk, medium risk category. And then you need to identify the employees within those critical risks who, by virtue of either their risk of transmission because of their work, or even their age or comorbidities, that are likely to be severely impacted if they do get COVID-19. Now, your risk assessment will then outline who those individuals are. Those are the ones who we need to put a policy in place to be vaccinated, to protect them, as well as to protect those whom they come into contact with. So please, this is very important. It must be based on something substantial, something measurable within the company. A risk assessment is not performed behind a desk. We need to have a collective agreement. We need to have a meeting with employees, with health and safety representatives. If you've got trade unions or company representatives, you need to include them into this entire process. And that is because you want to ensure that you don't take for granted that one person might be in a certain area of the business that is more affected than somebody else. Now, these are the ones, obviously, based on this risk assessment, you need to now develop a plan or amend your current plan, outlining the measures that you will take to implement the vaccination for your employees in accordance with these directives, as well as taking into account the guidelines that is at the end of this directive. That is called an Annexure C. There is a 2-page document at the end of this directive, an Annexure C, that gives you the guidelines for ensuring a fair policy. Because remember, you cannot just enforce something without discussing it first. Now, the question that many of our plumbers had when we thought we would have this type of discussion was, does this mean I can be forced to take the vaccination? Well, not at all. You cannot be forced to do anything against your constitution. Now, the Constitution of the Republic of South Africa, that is the Act of 108 of 1996, under Section 12 states that you, as an employee, as a human being, as a South African, have the freedom and security, and everyone has the right to freedom and security of the person, which includes the right to bodily and psychological integrity, to make decisions concerning reproduction, to security in and control over their body. And that is really the crux there, that you have control over your body. And then not to be subjected to medical or scientific experiments without their informed. I don't think this is an experiment. Obviously, the vaccination has been tested. Whether you agree that it's an experiment or not, again, you still have a constitution stating that you have this freedom over your body. Now, according to the consolidated directives, in particular, we're looking at Section 3.4. Employers must take into account the right of their employees to bodily integrity according to the Constitution as set out here in Section 12.2. Also, the rights of their religious freedom, their freedom of belief, and their freedom of opinion in terms of Section 15 of the Constitution, because that also allows every South African to choose and have the right to their own religious belief, their own personal belief, or their own personal opinion. But what does this actually mean then? If my company makes it mandatory and I refuse, well, where do we go from here? Is it a brick wall? Is it just going to be, I said you must, you said you can't? Well, the law is telling employees to do it and to come to a resolution. And the law is also on the side of the employee, stating, well, you have a constitutional right to reject it. Well, we must take a look at exactly what is trying to be achieved by implementing a vaccination. Remember the herd immunity side. We want to have adequate information, knowledge, and understanding of a subject before we go ahead with implementing anything in our company. So, for instance, before a company performs any work, and you as plumbers, you know this very well, and how many times during our Toolbox talks have we said risk assessments are vitally important to your tasks that you perform. Before you go out to work, we perform a risk assessment, we issue you a safety file, you do a health and safety plan, and you outline the methodology of work. How are you going to go about doing this work safely? So it's not just a step-by-step procedure of installing a geyser. Well, it's how are you going to install the geyser? Is it in a ceiling? Is it in a confined space? Is it working at heights? If you're working at heights, is it on a ladder? Is it on a scaffold? Are you using a mobile elevated working platform like a cherry picker or a scissors lift? See, there's so many other questions that we need to ask, and we're not asking that because we want to create more work. We're asking that so we can cover all our bases. You see, it's what we sometimes in the industry call a gap analysis. We take a look at what you are performing. We look at your safety file, your risk assessment, and we do a gap analysis. It's part of an audit procedure, but what it does is it helps to identify where there are certain gaps with the intention of providing a solution, not identifying where you went wrong. Rather, where is a gap? And if that gap is there, well, then there's a potential exposure. It's like a firewall for your laptop or your PC or your phone. A firewall prevents viruses from getting through or people hacking into your account. So it's like a solid wall, and you can open certain points in that firewall in order to get information across without exposing yourself to any viruses or hacking. So that firewall, and if you know what you're doing, you can open the exact right port in order to get the correct information. Well, health and safety is very similar to that. What we are trying to do is protect you, the employee, from not being injured. But we cannot just give you a solid wall. So we can't put a bubble around you and have no employees be impacted by COVID-19. We have to open up certain portals, certain ports in order to get information out and in again. So we have to send you out to site. You've got to work with tools. You have to work with other plumbers. You have to work with other contractors perhaps on a site. And so we will issue you with certain requirements, certain procedures to protect you. Now, the Annexure C, the directives, in order to help employers and employees come to a mutual agreement, is very much like that. You need to sit down and discuss what is the plan for implementation of a rollout of a mandatory vaccination policy. But the directives first state that the whole goal of these directives is to determine the fairness of a mandatory vaccination policy. Now, you might be saying, well, Chris, you don't think the same as I do. You're in a different situation. You're coming from a health and safety background. And yes, that is all true. But I just want to say to you, just as a personal note, when we were told we had a vaccination, was it probably about a year ago, I immediately said no. And you might laugh at me. Some of you would agree with me. Some of you would laugh at me. That's the beauty of being human, having our own opinion, isn't it? But I immediately said no. I thought, how is it possible that so quickly we can have a vaccination to a, SARS-CoV-2 virus that is spread throughout the world, but we haven't been able to cure things like the common cold, cancer. We haven't even been able to look deeply into things like HIV/AIDS. There's certain things that they can do, but all of a sudden, vaccination for COVID-19, is that really a possibility? I seriously doubted it. But I had to do research on it. We had to come to a decision as a family. And then when these directives came out, I had to look at it from a business perspective. And so it meant that I needed to take the time and look at what these vaccinations actually mean. Now, I'm going to be honest with you. I went for the vaccination purely because I thought it might impact my reputation with my clients. You see, if they call me out to site to perform an audit, to do a risk assessment, to do ISO implementation, quality management, and they ask me, have I been vaccinated? And I say no, how would they feel? Would I burden them by saying no? If I said yes, whether they like the vaccination or not, me saying yes doesn't actually affect them so much. So I know I came very much from a risk-based thinking, and that is unfortunately how I look at things, how I look at my entire lifestyle. It's always risk-based thinking. What is the least objectionable route? I'm getting that one wrong, but obviously I'm looking at how am I going to least impact people. So that's really what I made my decision on. I will be honest, I was very nervous when I went. I've had no side effects. Nothing went wrong. Everything's been okay. I'm going for my second one pretty soon. But when I discussed this with plumbers and when we started getting questions like this, I needed to delve even deeper into the vaccination, into policies, procedures, what is actually required. And I'm not saying 100% that you must be vaccinated, but according to us, we are definitely pro vaccination. And the reason for that is because of the studies that show 100% that those who do take it are less likely to have severe reactions. Now, don't get me wrong, I've heard of a lot of stories of people dying even after they've taken the vaccination. I have not personally come across that in my group of friends, but this is really why we are discussing these things, isn't it? We don't want to go with hearsay. You don't have to implement this just because Chris said this on the Toolbox talk. You don't have to do it because IOPSA is taking the stand of pro-vaccination. You don't even have to do it because the government is saying vaccination is good. What you must do is do your own research. Take a look at the Annexure C, the directives of this consolidated directives for the implementation of safe working procedures within your company. The second thing is to take a look at the general size and nature of the business, if it may warrant a different approach to this. So it's being very reasonable, very practical to every company to assist you in implementing some sort of policy, whether it's mandatory or not mandatory for your company. But notice also that these guidelines do not substitute the collective agreements or agreed procedures that your company has. Please sit down, take a day and discuss this with your entire team. And then don't just say your opinion, have an opinion that is based on facts. Do your own research. Remember, other lives are also affected. So yes, you have a constitutional right and you must always stand for that. At the same time, your employer has a health and safety right in order to protect other employees as well as their customers. These two opinions you might think are opposite, but they don't have to be. You can bring them together. It means, as point 4 says, that the key principle is that employers and employees should treat each other with mutual respect. Respect the decisions, choices, opinions, and beliefs of each other. But you cannot have an agreement without consultation. So, subject to this agreement, the plan must state that the identified employees who must be vaccinated when it becomes available to them, you must state in your policy and plan that they have a right to refuse it, as well as the right and opportunity to have discussions with their OHS reps or any unions. Now, finishing off on the Annexure C, employers, if it is practical and you find it is possible, please ensure that you make available transport to and from the vaccination site for those who have been registered on your EVDS registration system. This just helps you to make it easier for them to get to and from the vaccination point should they decide it. Now, if you do suffer from side effects, and we'll explain this in the coming weeks, we are going to talk about what is the vaccination, what are the side effects you might see, and what are the benefits of it. And this is why we are discussing it this month. But if you do have side effects, you are allowed to take paid sick leave in terms of your basic conditions of employment. If you do not qualify, in other words, if you do not have any more paid sick leave available, well, then you can have a collective agreement on what the company is going to decide, or you can lodge a claim with a compensation commissioner. So use your FEM form, use your Department of Labor COID form, submit a compensation request in order to get paid while you are off sick. If you refuse to be vaccinated, it is your choice. The employee must be counseled, and if required or requested, allow the employee to seek guidance from the health and safety rep, your workplace rep, or even your union. You will or perhaps need to be referred to further medical evaluation if the medical contraindications for vaccinations are applicable in your case. If necessary, and you are still refusing to be vaccinated, please, there is always a way around it. Employers, take steps to accommodate the employee in a position that does not require the employee to be vaccinated. In other words, put it in your plan. And what does this actually mean? What does reasonable accommodation mean? Well, in terms of this legislation, it means modification or adjustment to a job or the working environment that will allow an employee who fails or refuses to be vaccinated to remain in employment, first of all, and incorporate the relevant portions of the Code of Good Practice from your Employment Equity Act. This might include adjustment that permits the employee to work off-site or at home, perhaps in isolation within the workplace, in a secure office or in a warehouse or outside of ordinary working hours, so rotational hours. And in some instances, if they have limited contact with others, it might also include the requirement that the employee wears an N95 mask. Now, again, we are not answering every single one of your questions, are we? You might still have a lot of them. Well, this is the reason why we have IOPSA, the Institute, working for you. Get in touch with us. safety@iopsa.org. If you have more questions, send it through to us. Let us do our research. We might not come to you with an answer of what you must do in your company, but what we will do is give you a guideline to assist you in doing something for your employees. If you're an employee and you are refusing, give us your reasons why you are refusing it. Help us to understand what it is like on the other side of the coin. Not employers, but employees rather. Send us that information. You can use safety@iopsa.org. You can use info@ohss.co.za. You can send me a WhatsApp on 071-875-2070. Please always remember, working in a safe way means you will live long enough to see another day. Now, next week, we will discuss what is the vaccine. We'll look at Pfizer and Johnson & Johnson. Please don't forget these Toolbox Talks are accredited with 1 CPD point from SIOSH. And if you are a member and registered with PRB, you can claim your 0.25 PRB points. That is 1 point for the entire month if you attend all 4. Please don't forget about the COVID Compliance Officers course. It is available free of charge for you. You can either WhatsApp me or email me or go to our website and you'll find it there under services. And then the Man in the Van Education Through a Conversation podcast. You can find it available on many various podcast sites, as well as on your new app Plumber, Monday morning at 8 a.m. And lastly, just to end off, please don't forget to continually prevent COVID-19 by adhering to these 5 steps.